tension in your muscles and nerves. A lot of people carry tension in their nervous system and their muscular system, and they want to relax a little bit more, feel a little more comfortable, not have as much tension. So today we're going to go over how you can do that or how you can help yourself. My name is DrCary Yurkiw. I've been a chiropractor for over 26 years now. I saw a chiropractor when I was a young teenager, and that chiropractor really helped me. And at that time, I decided I wanted to become a chiropractor. And so it's been a journey of, about 35 years now. And I practice in Kelowna, British Columbia. And I've authored a couple books that are on Amazon, one on neck pain and one on back pain. So reducing tension in your muscles and nerves, that's our topic today. Just a quick disclaimer, it's best to see a health professional for your specific condition. So these are general recommendations I make to my patients, but it's really best to go in and get your condition diagnosed properly, whether it's a sprain or strain or fibromyalgia or whatever the diagnosis is. Get that diagnosed so a health professional can give you specific advice to help you with your muscle and nerve tension. So that's the best. The first step is really to go see a health professional. Also, I'd recommend that you educate yourself. So really learning more about your body and how it works, like in today's webinar, and reading books, go on the internet. And there's a lot of good tips that you can find on relaxing your muscles and your nerves. And so there's always new research and new ways of treating the body. So I encourage you, if you're suffering from a condition, to go and research it and educate yourself, empower yourself, and make some good decisions that way. So the nervous system, what is the nervous system composed of? Well, it's the brain and the spinal cord. That's the central nervous system. Then there's nerve roots coming from the spine that go to different parts of the body, like these peripheral nerves, these nerves that run down your arm to your fingertips, nerves that go from the lower part of your back, the sciatic, all the way to the tips of your toes. So the brain and spinal cord are the main highway, and then branches like streets come off that highway going to different parts of the body, including the organs. And so the brain and spinal cord control the organ function, and one branch of that is the sympathetic nervous system. The other branch is the parasympathetic. And I wanted to share that with you today because in order for your body to work properly, there has to be a balance between the sympathetic and parasympathetic to keep the right tone or tension level in the body. And if there's too much sympathetic or parasympathetic, the body can get off balance. And we'll talk a little bit more about that today. So what drives the nerve flow and the nerve signals, the communication between the brain and the body? It's your thoughts and your emotions. So the thoughts and emotions are formed in the brain. There's organs like the pituitary gland, the pineal gland that produce hormones, and combine the nerve signals and the hormones send communication to the body to respond to the thoughts and the emotions that you're having. And that is related to the environment you're in and your life and lifestyle. So we're going to talk a little bit more about that today. So the tone in the body is dictated by the nervous system, and the brain and spinal cord are sending signals controlling that. Sometimes people are in a fight or flight type of mode where their sympathetic nerves are firing, and that's to immediately get out of danger. So it can be, let's say you're walking through the woods and there's a bear there. It could be to respond to that. You're going to run away or fight the bear. And this is the sympathetic nerves. Or it could be to relax and regenerate the body. And that's more the parasympathetic nerves. And that's where it's a calm environment, calm and safe, and your body can rest and rejuvenate. So you need both. You need a balance between those two. The muscular system is composed of a number of layers. And generally, I say to my patients, there's 4 layers of muscle. There's a superficial layer. There's deeper layers that go right down to the core between the bones in the body. So there's small muscles that go from one vertebrae to another. And there's muscles that go from across 2 vertebrae, and then there's larger muscles. So you get the idea. There's many layers of muscles in the body. The body has over 600 muscles in it. And the muscles do everything from pumping blood. So when they contract, they pump help to pump the blood through the tissues. And then they help us lift something heavy. So when you want to move or bend or twist or lift an object, those muscles are active. They also help to support your posture. So muscles are important in that upright posture, sitting posture, laying down. So the muscular system supports different postures. And in the muscles, there's actin and myosin filaments. That's what causes a contraction and relaxation. So they kind of slide one past each other, causing contraction and relaxation. What can cause tension in the muscles? Sprains and strains, scar tissue, misalignments if your body has poor posture, and stress can all increase the muscle tension. One of the things I like to talk to my patients about is stimulants. Sometimes they're have too many stimulants in their body, and the tension level, the tone is increased. So lifestyle, rushing and too much stress, or food, too much caffeine, let's say, too much tea or coffee, chocolate has a lot of caffeine. That can overstimulate the body, get the nervous system firing and increase the tone, and then the muscles, of course, adapt to that. The environment that you're in is important. Too hot, too cold, smoky environment if you're out and it's there's forest fires. So all these different things can stimulate the body. You want to be careful of how much stimulation the body's getting. And then stress, sometimes from toxic relationships or work stress, boss or a coworker, that can increase the tone and tension level in the body too. Short-term stress is okay. So the body was designed to deal with and adapt to short-term stress. So the brain and the body are adaptive, but long-term repetitive type of stress or strain isn't good. And that's something that should be addressed. It causes too much sympathetic nerve flow, too much increased tone in the body, both in the nerves and the muscles. The spine's important because the spine protects the spinal cord and allows the communication, that nerve energy, that nerve flow to get through. So sometimes when we have misalignments in the spine, it can cause muscle tension in certain areas, but also can affect the nerve flow going through. So sometimes those bones or muscles can pinch the nerve, and then you can get a condition like sciatica when the nerve isn't working properly. And subsequently, the signals aren't getting through to the muscles, so the muscles go into a tight state of contraction. So the spine's there to maintain the communication going up and down from the brain to the body, and misalignments can affect the tone of the body in the immediate area, but also downline where those nerves are going. So it's a good idea to see a chiropractor, and a chiropractor can really help you to properly diagnose the condition, do the right treatments, and then release the tension in that area. So that can be very helpful for the nerves and the muscles. Another thing that I like to talk to my patients about is meditation. And meditation helps with the mind-body connection. So it helps to calm the brain signals. It helps to kind of reset the cycles in the body and the brain. So if you haven't tried meditation, it is something that I would recommend that you look into. It does really help to give us a little more resiliency, lower the tension levels and the activity in our brain, and then subsequently that affects our body. So it can really help us to have more range during the day to deal with different stressors that pop up. Stretching is good too. So stretching helps relax the muscles, it increases your flexibility in your body, and it does promote circulation. So a stretch routine, just a general one. Sometimes I give my patients like yoga stretches, like cat-cow position, which is a very good overall body stretch, can be very helpful to releasing tension in the body and allowing you to feel a little more comfortable. Breathing techniques are good too. So you don't have to do meditation. You can do a breathing technique that can help relax your body. And breathing techniques help reduce stress and help to stimulate the parasympathetic nerves. And those are the ones I showed you earlier that are the opposite of the sympathetic nerves, the fight or flight. So these are more like relaxation nerves that can really help you to your body's tone to decrease and feel more relaxed. We talked earlier about caffeine and stimulants. So your diet can sometimes be the cause of increased tension in the body. Caffeine and coffee, tea, and chocolate can overstimulate the body and cause too much tension. And then another thing sometimes is medication, or maybe some pharmaceuticals or other things, that supplements you could be taking. I would highly recommend you talk to a pharmacist or a nutritionist about some of the products that you're currently taking, because sometimes there can be some stimulant effects of those. Stress can cause too much conflict. So too much stimulation in your environment may cause too much stress. And if you're having some difficulty dealing with that, it's good to go for therapy or go talk to a counselor about it to help deal with the stress, to help better ways to combat the stress or to change the levels of stress in your body. And that's another thing that I'll often talk to my patients about if they're having trouble dealing with that. Sleep is really important. So if you have a lot of tension in your body and the nerves and the muscles, getting enough sleep. Generally, people need between 6 and 8 hours of sleep each day. If you're not getting that, if your sleep's interrupted, you may want to take some naps during the day, because sleep is cumulative and it really helps to relax the body. It resets the circadian rhythms that are in the body, and extra sleep can really be helpful for the body to heal and reset itself. Epsom salts. Most of us have heard about this, but Epsom salts contain magnesium sulfate, and it's a chemical compound that's made up of magnesium, sulfur, and oxygen. And when you put these salts, usually they're put in a bath, it really helps your body to relax. There's magnesium is the fourth most abundant chemical or mineral in the body, the first one being calcium. Adequate magnesium levels are essential for sleep and stress management, likely because magnesium helps your brain to produce neurotransmitters that induce sleep and reduce stress. So an Epsom salt bath is a really good idea, and doing that on a regular basis until the tension levels reduce will be good for your body. Also, chamomile is great, and chamomile is frequently found in tea and supplements. It's a herbal remedy that contains flavonoids, a compound that is well known for its anti-inflammatory qualities. Chamomile's essential oils are used often in massages and soothe discomfort. So you might want to look into a chamomile tea, or maybe a chamomile supplement cream that can really relax the muscles. Cayenne. Capsaicin is the active ingredient in cayenne peppers. It gives them a bit of spicy kick. The spice also relaxes muscles naturally, and it also is available widely in creams and ointments, and will alleviate spasms when it's applied to the overall area where it's tense. So cayenne can really help the body to relax, and even though you would think with the spicy qualities it might stimulate the body, it actually helps the body to relax and those muscles to relax. Vitamin D is great. There's been a lot of attention on vitamin D lately, and often muscle pain that we experience is due to a deficiency, and vitamin D can be a culprit. Vitamin D is found in eggs, milk, fatty fish, and the lack of vitamin D can cause muscle and nerve pain to worsen. This is especially the case in sufferers of fibromyalgia. So quite a few of my patients have fibromyalgia. They're kind of sore all over or in certain areas. And vitamin D is very important to help the body so that the nerves and the muscles can relax. Magnesium, we talked about that earlier, like Epsom salts. Magnesium-rich foods include bananas, brown rice, almonds, and this can help the nervous system to heal because it helps to produce the neurotransmitters. If you need help and you live in the Kelowna area, feel free to contact our clinic. We'd be happy to help you. And our phone number is 250-486-0062. If you want a referral to a chiropractor in your area, if we do know of a chiropractor there, we'd be happy to refer you. You could call or you can email me. I'll give you the email address in a minute. The book on back pain is on Amazon. It took a long time to write that book, over a year, and I was able to write back pain first and then neck pain. It looks like this. So if you go on Amazon, just type in back pain and then my name, and then this book will pop up. You can get it in paperback or ebook. It's in the Kindle Unlimited program. You can read it and borrow the book. And then there's an audio version of it as well. Make sure you join us for upcoming webinars. We have quite a few coming up. Usually do 1 or 2 a week. And if you go to DrCary Yurkiw Chiropractic on Eventbrite, you'll see the list, and most of them are free. You just have to sign up for it, get a ticket. We're working on connecting the link to the webinar. We're using Google Meet now to the webinar. So hopefully when you do get a ticket, you'll be able to get the registration link now, and you won't have to rely on an email. But I've been sending out emails the day before just to remind people. We do have this special offer. So if you live in the Kelowna area and you want to discuss your specific health issues, we're offering a free 15-minute consultation, and that could be in the clinic, could be done on the phone. And this is good until November the 11th. So you've got a week to use that. And just call 250-486-0062. Again, it's for people living in the Kelowna area that can come to the clinic. My contact, I'm at 105 1628 Dixon Avenue. I've given you the phone number, the 250 number, and then the email address is drcaryyurkiw@gmail.com. So if you have any questions, feel free to send an email. Usually I'll respond within 24 hours to an email. On social media, you might want to follow us. We're very active on Instagram, Twitter, Facebook, and increasingly active on YouTube. We'll post a lot of these webinars that are recorded on YouTube. You just have to go to @DrCary Yurkiw, that's our handle, and you'll be able to see our profile and just follow us. On YouTube, subscribe to our channel. And then we have a podcast called Super Healthy. You can access that podcast on Apple. You can access it on Spotify. It's on Google. And just follow that or subscribe to that podcast, and then you'll get updates as new webinars are available. It's an audio format. Our website is www.caryyurkiw.com. I want to thank you for joining us today. I hope you learned something about reducing tension in muscles and nerves, and I look forward to seeing you next time or at the clinic.